So your eyes hurt, they're red, and any photon of light feels like daggers are stabbing your eyes. What's going on and what can you do? So if you have these symptoms, you might be suffering from something called uveitis. When you hear anything that ends in itis, think inflammation. Inflammation usually happens when your body's trying to fight an infection. Well, this is inflammation in your eye, and uveitis results from not an infection, but generally from your body attacking itself. This results from an autoimmune condition you may have that is causing inflammation in your eye. You can be light sensitive, have blurry vision, and more than anything, you might have a disease that's affecting your whole body. So if a patient comes in, has these symptoms, and we know they have an autoimmune condition such as rheumatoid arthritis, ulcerative colitis, sarcoidosis, lupus, or multiple sclerosis, to name a few, we're going to start thinking that that condition is causing the inflammation. Now, I do have patients that come in, they have inflammation in their eye, it's uveitis, and they didn't know they had an autoimmune condition. We get the inflammation under control, we send them to get blood work, and you know what? The eye is the key to diagnosing that autoimmune condition in their bodies. Lo and behold, they usually have other symptoms, it's just the eye that brought them in to see the doctor. Now, in terms of the eye, the things that we're gonna do is number one, get you feeling comfortable. We're gonna put drops in your eye that's gonna make the pain, the light sensitivity less. We'll most likely give you a steroid eye drop. This steroid drop is gonna suppress the immune system and make your inflammation go down. This will help with the redness and irritation and blurry vision. Now, in severe cases, oral steroids might be necessary or even injections of steroids. But generally, if you get in and see your eye doctor when it's early in the process, topical drops will be enough to get the inflammation down. So if you have these symptoms, don't wait, get in and see your doctor. Now, obviously, the eye is my concern, but we want to treat the whole body when you go in and see your doctor. So make sure that after you get the inflammation taken care of in your eye, you follow up with your primary care doctor, a rheumatologist, or endocrinologist, and we get to the root of the problem. If you learned something new, like, subscribe, and we'll see you in the next video.